It's time for our next PPT, which is the last presentation of this session before tea break, and it is on allergic pharmacotherapy and immunotherapy by our next speaker, who is also a distinguished guest all the way through Islamabad. He's Dr. Shahid Abbas. He's a consultant allergy and immunology and practices in Islamabad, Rawalpindi, and Dubai. He is also a fellow of American Academy of Allergy and Immunology. He's a president of Pakistan Allergy, Asthma and Immunology Society. He's also an active member of World Allergy Organization and different research groups. Sir, please come on stage.
First of all, I'd like to thank Dr. Najm and the organizing committee for inviting me for the presentation. And I am glad to see the eminent dermatologists of the country over here. So in my first presentation, I'll be speaking about the allergic pharmacotherapy and immunotherapy, but in my next two presentations, we'll together try to set up the patch testing clinic and the allergy testing clinic. So that will be a bit of an interactive course, a short interactive course, and we'll be doing demonstration also and presentation, and you can ask the questions in between. So I just like to, yes, so World Allergy Organization, these are the logos of World Allergy Organization. Logo of the Pakistan Allergy, Asthma and Immunology Society. Basically, Pakistan Allergy, PICE is the member society of the World Allergy Organization. And World Allergy Organization and PICE, I just want to say that these two societies are not particularly related with the one specialty of allergy and immunology. In fact, it covers all the different specialties. The executive members and even the president can be from any specialty. I have seen there were president from the dermatologists, ENT surgeons, pulmonologists, so anybody can be the president and anybody can be a member of the executive committee. Because in fact, allergy affects every system in the body, not only one system. It is multi-specialty organization. So this is my Dubai clinic, our Islamabad clinic, and now we are setting up the big department of allergy and immunology in PF Hospital, Islamabad, which will be a center of excellence with the collaboration of World Allergy Organization. And in the whole of Asia, there is only one center of excellence of allergy and immunology. That is in Korea, and we are planning that we should develop such center in Pakistan too. That will be in PF Hospital. Next, please. So, allergy affects every system of the body, every organ of the body, not only one. And PS and WOW are the multi-specialty organizations. Just a few words about the introduction of World Allergy Organization. World Allergy Organization is basically an umbrella organization. This is an umbrella organization which has about 100 different allergy societies of the world. Each society represents one country. One society of allergy and immunology represents that particular country in the world. So, the World Allergy Organization implements its programs through these member societies all over the world. And the programs are to develop the excellence in clinical care, educational, research, training, and awareness programs. They are all coordinated through the programs of World Allergy Organization. So, if you visit the World Allergy Organization webpage, a tremendous knowledge base is there for every society, every specialty. You can think of any search, you can find it there. And if you are a member of our society, PICE society, you will automatically become the member of the World Allergy Organization also. So there are huge database that you can find for your research. There is a WOW journal, free journal. They are all free for the members and non-members even. So you can download a white book on allergy. That's free, big book that's considered as Bible in allergy, that you have a tremendous and latest knowledge about allergy. You can download it from yourself. So there's a WOW TV. There are videos about the different diseases, different lectures are there. There are Allergic Disease Resource Center. Ask the world experts. They are there, and you can ask them. The interactive active case reports are there. Their learning modules are there. So you think of any knowledge that you want to gain, it's there on this web page. So you can log in and you can just see the things. So PICE is, in fact, I just want to disclose that we are, in fact, if you read our website, you can link to you can go to the WOW web page and explore anything you want to explore. So I just wanted to give you good news that 30th of January 2020, there was the greatest breakthrough which we have been waiting for ages. That is allergy immunotherapy for peanut allergy. Previously, peanut allergy used to cause severe allergic reactions and even anaphylaxis, but thanks God, they have developed and it has been approved by the FDA too. So, and in fact, this last few years has seen the tremendous developments in the world of allergy. There are the greatest developments. Some are biologicals, like Xolair and Concentrix for psoriasis. So Palfariza is a FDA approved OIT, oral immunotherapy for peanut allergies. So, but the important thing is it has to be given in a clinic by a doctor who is trained to treat the anaphylaxis, because sometimes the adrenaline has to be given and there can be anaphylaxis too. So it must be given in the clinic only there, the first dose. And I'll discuss about the later doses also in my next slide. So the patient has to be observed for 1 hour when he comes to the clinic after the first dose. And if because the immunotherapy is a prolonged therapy, it is not a single day therapy, it has to be given for nearly 3 years. So there are different steps that we can discuss in my next slide and tell you how to manage it. So, firstly, it is present, sold in form of capsules and in form of the sachet. There is a initial dose. There is a initial escalation dose, mid-escalation dose, and maintenance dose. The capsules in the initial, these 5 doses have to be given in one single day. The initial escalation dose has to be given in the first day of your start of the treatment. Starts, how you will give it? You will break the capsule, sprinkle it on the 2 teaspoonfuls of the yogurt or the pudding, and the patient can take it. But patient has to be in the clinic, not at home. No way patient is allowed to start the treatment at home. So he has to be there in your clinic for all these 5 doses. He starts with the 0.5 milligram capsule, 1 capsule. Then after half an hour, the next dose. Every half an hour, one has to switch to the next dose. For 5 consecutive doses, the patient has to be in the clinic. after the finishing of the last dose, patient has to be in your clinic for 1 hour for observation. Please don't let him go, because the anaphylactic reaction can take place in first half an hour mostly. But if nothing is happening, it means it is quite safe. But still, if patient is going to his home, and you must instruct him that if you have unusual symptoms, then he must come back to the clinic. So, starting with the initial escalation dose on the first day, from the next day, you start with the mid-escalation dose. That is 3 milligrams every daily for 2 weeks. Now the second phase is every 2 weeks. First is on the first day, then the next mid-escalation dose is every 2 weekly, every 15 days, there is an increment of the dose, and then these are for 11 complete cycles. This is 22 weeks. Then at the end of you start with the 3 milligram in the mid-escalation dose, and you reach at the 300 milligram session. So the last mid-escalation dose is 300 milligrams, and mind it, this is 300 milligram daily for 2 weeks. And then this 300 milligram goes into the maintenance dose that continues daily for another total period of, say, about 3 years. They have not definitely done it, prescribed for 3 years as yet, because it is a new OIT. But as a general rule for all the immunotherapies, the recommended time period is 3 years. That can be extended to 5 years, but 3 years is the minimum. I just want to disclose one thing, that there was a time of around 2013, 12 or 13, when it was a time that food allergy testing was considered as inappropriate for the diagnosis of allergies, and immunotherapy for the food allergies was also considered as inappropriate. But we started this immunotherapy and skin testing in 2002, and we were giving it. But just imagine that as the time changes, what happens? Which was considered as inappropriate, that is now approved by the FDA, and is considered as appropriate and most important and life-saving. So you'll be having a very good news in the near future for the wheat allergies, cow's milk allergy, and egg allergies also. They are in the pipeline, and soon you will have the immunotherapies for these allergies also, because there is a success rate of 70 to 80% up till now, and it is going to be announced very soon. So we are in fact already doing the immunotherapy for the wheat allergy, even for the gluten allergy also. I am having a lot of patients, and we are treating them very successfully, and we have seen that in most of the patients, even the enzymes have gone down and they are improved. So just I want to mention one thing, that the dose of Palforizar is $1,000 per month in USA. But we are thinking of providing it with $50 per month in Pakistan. We are developing it, we are working on it. And this is considered as a powder in a capsule, but we are developing in the form of powder now there's two different things. Sublingual immunotherapy, SLIT, and OIT, oral immunotherapy. Oral immunotherapy is swallowed through stomach, is absorbed, and then it causes an immunological effect. And the sublingual drops are through the sublingual route under the tongue. So we are developing both sublingual drops also, and for the OIT also. And we are expecting that we'll be selling it for $50 per month when our results are satisfactory and we are happy with we can start with the patients. So allergy, IgE, and what is allergy? Is an abnormal response of the immune system of the susceptible people who have genes of allergy, and this abnormal response is to the things which are considered as harmless substances, but they are considered as harmful for the body by the immune system of the susceptible person, and body starts reacting. So there are two phases: phase of sensitization and the allergic reaction. Everybody of you know about it, and it takes a few months to few years for the allergic reaction to develop. So in first stage of sensitization may take even years, and then suddenly one starts having the allergic reaction. You can see the first phase. This is phase of sensitization, and then on the second exposure, the allergic reaction takes place. Second exposure after the sensitization. I want to, before we discuss the main slide, I want to show you that human body is like a rain barrel which is exposed to huge amounts of environmental pollutions daily entering the body. And what are the environmental pollutions? They are the chemicals like insecticides, pesticides coming through our foods, air and water, and even the air and even the foods. And then there are biological pollutions like pollen, dust, host dust mite, molds, they are also environmental pollutions. Now, our body is exposed to huge amounts of environmental pollutions, and our immune system is trying to get rid of all these environmental pollutions by neutralization, detoxification, excretion. But our immune system also gets tired, and then when the immune system gets tired, it gets exhausted, different diseases develop, not only the allergies, since everybody of you know that when the immune system is sick, one develops any disease like infections or any disease. Now, and why somebody develops an allergic disease? This is basically, allergy is genetically transmitted immune disease. So when allergic genes, person having the allergic genes, coexist with environmental pollutions, and the allergens get into the body through the air, water, and food. So when three things coexist for a longer period together, then these genes get activated and suddenly person starts developing the allergic disease. So what are the types of allergies? There is apparent allergy, there is a hidden allergy. Apparent allergy is that allergy where you know the cause of the allergy, and you will easily remove the cause of allergy and you get better. The other is hidden allergy, where you don't know the cause of allergy. Somebody is coming to you, he says, "Doctor, I take beef, but it's really, sometimes I take beef and I have a problem, sometimes I don't take beef, still I have the problem." So that's a hidden allergy. In fact, the person doesn't know exactly what is the cause. That's confusing. So that hidden allergy is important, and it can be dangerous too. So there are two types, apparent allergies and the hidden allergies. So I just want to say a few facts about the allergy which I think we should discuss. That's important I should tell you. One is allergies, we have discussed it, is genetically transmitted immune disease. If two parents are allergic, 2 out of 4 children will be developing allergies at any time of their life. One child may develop at the age of, say, 1 year, the other may develop at the age of 60 years. That is due to the interaction of the environmental pollutions and the immune system. So it varies, but they are going to develop allergies. 2 out of 4. If 2 parents are allergic, 3 out of 4 will be developing, and if 1 parent is allergic, 2 out of 4 will be developing allergies. Individual susceptible. So allergy appears from infancy to old age any time in the life. Allergy progresses both in severity and in frequency with time. It starts with the milder disease, becomes severer with time. It develops occasionally, then person starts having symptoms frequently. So it progresses both in severity and frequency with time. It is good with urticaria, it is good with allergic rhinitis, it is good with asthma, it is good with IBS, it is good for every, it is a general disease. So allergy affects every organ in the body. I'll show the picture from head to toe. Why I say allergy affects every system in the body? Because the allergen, when you take something allergic, then that food or that thing in the air goes to your blood ultimately in the form of very nanoparticles and circulates with your blood all over the body. And your mast cells are in millions distributed all over the body, from head to toe. So these allergen molecules, when they go to the different parts of the body and they attach to the mast cells, ID molecules of the mast cells, anywhere, from head to toe, from brain to the foot. So the symptoms start there. There is a one main organ, for example, asthma. That is the severest symptom. That's the target organ. But the minor symptoms will be there in the all over the body. That we'll discuss for them. So sorry. So last thing, shifting of the body organs. People, I get a lot of patients, and this is a rule also that allergic is people start with allergic rhinitis and ultimately develop very severe asthma slowly. And I get huge number of patients in Islamabad. The patients coming to me with the pollen allergy to which is papermobile there, they are having all the symptoms. They have arterial rashes, itching in the body, they have asthma, all the symptoms are there. They are feverish also, they have pains and aches in the body. So every system in the body is affected. The last thing that fact about the allergies, I just want to give a very important message for the parents, for the teachers, that allergy affects the physical and mental development of the children. So please get the proper treatment at the proper time, at earlier time, before your child develops severe developmental problems. So I just want to show you here that this allergy rhinitis, this allergy affects the whole of the body, every system in the body. So from head to toe, every system will be affected. Just I want to say a few words of the allergic rhinitis or asthma or urticaria. These are all you see the patients. These are only the tip of the iceberg, but that's a main organ which is being affected. Okay. So the time is very short. We'll be stopping in first. How many minutes I got? 5 minutes? Right. So person will be having all the symptoms if all these symptoms are there, although the main symptom will be either asthma or urticaria, but he'll be having other symptoms too. He may not be having all, but there will be some. There are cross reactions. There was a good slides our colleague just presented for the oral syndrome. I just want to tell you that there are cross reactions with the oral, with the food allergies, and for example, grass pollen allergies. People having the grass pollen allergy, they can have also the oral allergy syndrome from these different foods too. And when you treat the grass pollen allergy with the immunotherapy, this will also be improved. This also vice versa, that some people having the allergy to these foods, they can have allergic reaction to the grass pollens. So this is the early signs or symptoms of the allergy of the child before full-blown allergies develop. I'm sorry, I have to be very quick, finish it in 5 minutes. So these are the early signs symptoms. The treatment and pharmacotherapy that we wanted to discuss. One is treating, how do we treat the symptom? There are two types of treatment which can be symptomatic treatment and treating the cause. If we treat the symptoms, either we treat the symptoms or don't treat at all. In allergy, the disease progresses. It is going to progress because it is genetically transmitted immune disease. It is not an infection that you give an antibiotic that it should be cured. It is genetically transmitted. It is in the gene that it is an immune response, so it is going to progress. So, but if we find a cause and treat the cause immunologically, then the patient is going to be improved. So management. Let's quickly finish. So management is allergy avoidance is the best treatment, which should be first recommended. But can we avoid pollens in the air, which is floating all over? Can we avoid the chemicals which are present in the air? Can we avoid the house dust mite, which is causing most of the allergies of perennial type? Because there are 20,000 house dust mites in one bed, and it stays in the mattress. It eats the human scales which are falling from the body, and it is present all over the world. You cannot get rid of it. So avoidance is possible in limited way, not for everything. Yes, pollen allergy from say paper mulberry in Islamabad, they can travel to Karachi and be away from that for the pollen season, and they will be much better without the treatment. So pharmacotherapy is really good. We have to prescribe the pharmacotherapy along with immunotherapy because the symptoms have to be controlled along with, because it takes some time for the immunotherapy to be effective, and initially pharmacotherapy has to be given. But we cannot give the pharmacotherapy for the lifetime. With all the side effects of different steroids and other medicines, we cannot prescribe it for a long time. So the best option is the combination of all these treatments. Immunotherapy, avoidance, and pharmacotherapy should be given for the patient. So, allergy immunotherapy. So just quickly now, few words. Immunotherapy is 110 years. Before that, immunotherapy was not there. I was discussing with our colleagues also that it started in 1909, but with the injectable immunotherapy, which was what people used to have trypanophobia, fear of pain of injection, and there has been a lot of reactions. And in England, there were about 9 deaths in 1980 to 1990, and that's why they banned it over there for some time. But again, they are now. But some of the places it is still continued. And the latest things which have been approved by the FDA is oral drops, sublingual drops, which we are developing, we have also developed it in 2002, and all our patients are getting in Dubai also and in Pakistan this sublingual. And this oral tablets also approved by the FDA, and it's being sold all over the world. Evolution in the immunotherapies are just how it developed. Sorry, quickly. This was the first paper in Lancet in June 1911, when Noon and Freeman, they developed they called it inoculation. At that time, the immunotherapy was started at that time by these two gentlemen, and they were from the same place where I did my job at St. Mary's Hospital. I mean, they were in a small lab over there at that time when they developed. So this is important. Just I want to tell you that immunotherapy, its name has been changing with different times. Initially, it was called desensitization in 1999. Then they thought it is not a desensitization; it is prophylactic inoculation in 1911. But it changed to different names. But the best now, it should be called as allergen-specific immunotherapy. Why allergen-specific immunotherapy? And you must be having a lot of questions that we send a lot of patients to for the desensitization, for the allergy immunotherapy, but not many are responding. Not many are responding because that was not a specific immunotherapy. If you give a specific immunotherapy, allergen-specific immunotherapy has to be given. There is no generalized immunotherapy for everybody. Everybody has got different allergies to different allergens. So immunotherapy has to be specific. So, SCIT was subcutaneous immunotherapy and SLIT is sublingual immunotherapy. So these are the guidelines of World Health Organization that immunotherapy is the only available disease-modifying treatment for the allergic disease in the world. It's the only disease-modifying treatment. It is sustained clinical benefits after completion. Prevent developments of the newer allergies. Prevent asthma and food allergies. It is cost-effective. You compare giving the steroid inhalers and other treatment for longer period with the immunotherapy, the cost is much lesser and it is safer too, and the effect is lasting. Just the treatment I want to say, and then we'll finish it, that this cost for the 1 month is $300 to $400 in USA. Of these, some are grass pollen allergies, some are house dust mite pollen allergies, and pulveriza is $100 per month. But we are selling for our patients, same thing for about $10. So compare of the same international quality, because I was trained by World Health Organization, while I was chief of the NIH Allergy Center in production of vaccines, allergic vaccines and allergens. So we can manage all those things very easily. It's very easy for us. I think I should finish it because we must be leading your tea break. Thank you very much.